Hi, this is Nina, and welcome to episode 2 of PupMed. Today, I'll discuss the risk factors and science behind osteoporosis. It's commonly thought that osteoporosis is just something that just happens to you as you get older and your bones just fall apart. Well, not exactly. Osteoporosis is a severe decrease in bone mass, and that leads to a decrease in bone strength, which puts you at a higher risk for falls and fractures. This is one of the articles that I'll be referencing today. Let's first talk about how bone works. There's a balance between new bone growth and bone breakdown, and both are important. Bone growth is important, especially in children who are growing and developing, and bone breakdown is actually also good because that is a huge source of calcium for your body. Now, what are some risk factors for developing osteoporosis? One factor is old age. So, when people age, what tends to happen is the body shifts the dynamic of these two competing bone processes. So, what ends up happening is the rate at which bone growth is happening goes down a little bit. So, it's lower, and therefore, you get an overall higher activity of bone breakdown. But technically, you can still get osteoporosis at any age. It just so happens that in aging, it becomes more prevalent. Another risk factor are estrogen levels. Serves as a regulator for bone growth. And what it does is it promotes new bone growth and prevents bone loss. And so, in patients who have lower levels of estrogen, such as those going through menopause, what happens is that there is less of that protective effect for bone growth, and therefore bone loss happens more, and that leads to osteoporosis potentially. One point I want to make about supplements such as estrogen therapy for osteoporosis prevention is that there are certain patients with risk factors and other underlying medical conditions that may actually not work out for you. Too much estrogen is not a good thing. Too little of estrogen is also not a good thing. And so it's very important to have this discussion with your doctor because taking these supplements can have potential health consequences. Thanks for learning with Mr. Baby and me today, and we'll see you in the next episode.